unless you get started, you're never going to go down that train and learn. You can always learn, even if there's a new innovation, a new technology, you're still going to learn from that old one. It's technology. My iPhone I have to trade out all the time, right?
It's going to change, just get started.
Just get started. And the barrier of entry just is getting less and less. It's getting easier to use, which is awesome, and it's costing less, which is also amazing. And then we get to do more with it.
Welcome to Schein Chats. My name is Jennifer Clark and I am with Henry Schein Dental, and joining me is Dr. Kristine Aadland. Thank you for joining us.
Well, thank you for having me. I'm excited to be here.
Thank you. Before we get started, I have just one question for our audience. Are you optimizing your dental workflows? Think about that for just a second. Now, I for one know that many dental practices, many offices are just simply not optimizing their workflows. But what if you can streamline your entire practice, your entire, workflow with the addition of something like the 3D printing technology? We're going to go ahead and dive right in right now to show you exactly how to optimize your dental practice workflow, what works, what doesn't work, and the role of dental technology. Dr. Aadland, thank you.
You're welcome.
Now, I have a million questions for you, but I have narrowed it down to just 4 and then maybe just a fun little bonus question.
Sounds great.
All right, well, let's get started. First up, what are some of the current technologies you find most impactful in dental practices today, and how do they complement the utilization of 3D printing?
Yeah, that's a great question. And it's a fun, exciting time in dentistry right now because everything's becoming a little bit more user-friendly, barrier to entry is a little bit less. Obviously, I love 3D printing. In order to do that, we have to have our iOS scanner, obviously CBCT technology.
Sure.
When I started way back when, the cost was so high, but they're coming down, and not only they're coming down, but we can have so many other uses for them, which is pretty awesome.
Definitely.
Yeah, and then of course there's software, because then we have to design too. So.
Oh, don't forget the software.
I know.
All right. Well, how do you approach the learning curve associated with mastering various applications of these technologies?
It can be so overwhelming because there's so many things. Example for printing, like we can print night guards, we can print dentures, we can print models. There's so many things, and it can get overwhelming in that sense of how do I know this workflow for everything we do? But the truth is that workflow is actually pretty simple. You scan, you plan, or you design, and you can either do that, or you can use AI, or you can use your partner lab. You can farm that out, which is really nice, and then you manufacture, whether it's printing or milling, and then you process.
Okay.
And these manufacturing and processing systems are so more user-friendly today.
Yes.
You put one in a box and it comes out on the other side. Like, for us, like we used to have Tupperware full of alcohol, and we used to have little UV scanners and nail lights. Like we had to get so creative, and now it's just easy. Easy for me, easy for our team members. The cleanup's easy, all of it, which is great.
That's awesome.
And then you deliver.
Yes.
It's really one workflow. You just got to fill in the details depending on what you're making.
Yeah. Good to know. Well, could you elaborate? This is one of those things that you've actually talked to me in the past about, but could you elaborate a little bit more on your approach on streamlining workflows and making these technologies more accessible to your fellow practitioners?
Yeah, I mean, obviously I'm kind of a technology geek, so I tend to be a little bit on that forefront. My practice either loves that or doesn't love that because I'm always bringing in new things. As far as streamlining that in, so much of it has to do with communication, and I think that's where we kind of hold back. Like, I love being at this conference at Thrive Live because you involve the whole team. Because it's so easy for me as a doctor to go here and then I come back and I'm excited, and my team has no idea what I'm talking about or even how to implement it. And so we have to start those conversations with the front office because they want to know, how do you schedule it? How do I talk to my patients about it? How do I bill it? Like sometimes even that changes. How do we treatment plan it? And then I have to talk to my hygiene team about it because they're in the forefront. We all know patients love our hygienists more than they love the doctors. So they want to know, do I clean it any differently? And what does that look like on their end as far as talking to the patients? And then of course we have to get our assistants involved. And how do we maintain the technology? The good news is there's so much knowledge. You don't have to go to a dental conference anymore. Online, there's so much accessibility, and they're making it easy. Like it's small sound bites, small videos, and that is
Yeah.
so cool. So bringing it in, I think really involving the whole team.
Yeah.
Don't forget to tell your team why you're doing this. Because in our head, like, isn't it obvious that I'm bringing in printing because it's better for the patient?
Yeah. Yes.
I mean, you think that, but if my team members don't know if a printed crown is as good as a milled crown or printed denture versus a milled denture, like I need to have those conversations and see what is the benefit for the team, what is the benefit for the patient.
It's like, what is she bringing in now?
Right, I know, what is she bringing in now? I get that a lot. There's always a little fear when I come home from a conference.
Yes. They're probably wondering that right now.
Yeah.
Oh, thank you for that. So finally, what advice would you offer to aspiring dentists and dental professionals who are aiming to embrace innovation and leverage technology to enhance their careers as well as patient care?
I think my biggest advice is truly just to go for it. Like we get a lot of paralysis because there's so many decisions now. And then you're always afraid that it's going to change. Like, what if I buy this printer and then the new one comes out tomorrow?
Yes.
But unless you get started, you're never going to go down that train and learn. You can always learn, even if there's a new innovation, a new technology, you're still going to learn from that old one. It's technology. My iPhone I have to trade out all the time, right?
It's going to change. Just get started.
Just get started. And the barrier of entry just is getting less and less. It's getting easier to use, which is awesome, and it's costing less, which is also amazing. And then we get to do more with it.
True. Very true. Thank you for that. So just really quickly, I'm going to ask you my bonus question. What is the weirdest thing you've ever seen 3D printed?
Oh man, the weirdest thing. I keep trying to think of those. I don't know if it's maybe it's the weirdest thing. So I do have some friends who they'll add little toy printers in their waiting room, and then they have the STL files ready to go so that kids can come and they can print their own toys, which is pretty fun. There's so much out there.
I don't think there's anything weird anymore.
I know.
That's a tough question. I'm sorry.
You can use it for marketing. You can use it for, it doesn't have to be just dental related, which makes it fun in your practice. All you need is an STL file.
Yes, I agree. Well, thank you very much. Truly, you know, your passion for innovation and your dedication to patient care is it's so inspiring. Really, thank you so much for joining us at Henry Schein Chat.
Thank you for having me. I really appreciate it.